Hi, I'm Dr. Jeff Hedrich. I've been a chiropractor for about 16 years now, and over those years I've encountered many cases that we've had somewhat difficulty in managing and finding a real solution for them. Different treatments have not produced the results we were looking for, and some have been outright failure. I'd like to introduce a new technology called Shockwave therapy, and this technology itself may be beneficial for some of your patients as well. People who have conditions that are not responding very well to traditional management, and they don't really need surgery, but they need something else. The research for Shockwave is absolutely wonderful. It's one of the few modalities out there that can go through the double-blinded randomized control study, so that neither the patient nor the doctor are aware of what the procedure is being done. It's also one of the few studies that has excellent histological research done on it too. Film slices of tendons in control groups versus treatment groups, film slices of ligaments as well, and also non-union in fracture and bone. And a lot of these tissues have been in turn subjected to dynamic load tests to find out if they have actually improved, and the research is quite compelling. But my job is not to convince you that the research is outstanding, because it did its own job for me. I was quite confident in the research myself. But clinically, we have seen results that are even far beyond what my expectations were. So we're talking today with Celeste.
Hi, Dr. Hedrich.
Hi, Celeste. So thanks for joining us. Now, Celeste, we've been working with a problem with you in your SI joint for quite some time, and we had limited success there.
Correct.
Okay. Now, can you tell me a little bit about what you were feeling in that SI joint?
Prior to this treatment, I was having lots of pain down my right leg, lots of numbness, difficulty functioning in my job, difficulty sleeping at night, taking lots of analgesics to try and manage that discomfort.
Okay. And what are the different therapies that you have tried already for this problem?
I've tried several chiropractic treatments. I've had different types of anti-inflammatory drugs. I've had several injections into that joint.
Okay. What kind of injections were you having?
I had the cortisone and xylocaine injections.
So a
to do
freezing
blocks.
and a steroid.
Right.
Now, how is this affecting your life?
Since this will only be my fourth treatment this time, but even the initial treatment, there was a big change. I didn't have to take analgesics after. There was an instant relief in the actual shooting pain down the joint, and that lasted for a lot longer than I'd expected, and the changes were just phenomenal.
Okay. Now, Celeste had to manage this with painkillers, is that correct? An
Correct.
Anti-inflammatory?
Correct.
And did you notice a difference in how many anti-inflammatories you had to take for that?
I sure did. Prior to getting this treatment, I was taking anywhere from 8 to 10
8 to 10?
Tylenols a day and
Per day?
Advil per day
Okay, per day.
to manage the pain.
And now you take how many?
I probably, in the last week, I've probably only taken 2 or 3
2 or 3?
tablets themselves.
In total or per
in
day?
Total.
In total.
In total.
Very significant reduction in drug consumption, and we have to be honest. This is a concern that we should put greater importance on, the way it taxes liver and kidney, and especially when you've got the potential to combine with other drugs and produce different unwanted side effects. So it's a great thing for you.
And another big change is I've been sleeping through the night, where before I'd be waking up 4 or 5 times in the night just with discomfort shooting down my leg and numbness. And
Okay.
yeah.
Quality of sleep, a huge thing for people. We all know that good night's sleep is worth $1 million. So what we're going to do now is, oh, just one more thing. You were considering some other treatment options too, right? Prolotherapy?
I was.
Prolotherapy was an option.
It was. What appealed to me about this is it's non-invasive.
Mhm.
The time frame of treatment was shorter to do this, and anything that's shorter that gets you more active quickly is key to me too. So.
Okay, great. So we're going to do a demonstration of the treatment on Celeste. So we're going to have her lay face down here. And just come in and get a close-up view of this region of the subject, Celeste. So what we do is we apply the ultrasound gel onto the affected area. Now I'm not exposing the full amount. We're going to go down to about here off camera, but it's a fairly modest procedure. The first thing we do is we put the ultrasound gel down here. That's a conductor to reduce cavitation on the skin and reduce redness and swelling. And you'll see that what I'm doing is I'm looking at the junctions here, the lumbosacral junction, we got the sacroiliac joint, and we've got the rim of the ilium itself. And this is an important area to treat because there's a lot of enthesiopathic changes that occur in this region, and the Shockwave is a fantastic tissue regenerator. So anytime we can reduce calcification, keep a tendon ligament healthy, help to stabilize a joint, and prevent microtrauma to cartilaginous surfaces, I think that we're making a really good contribution to that person's future well-being. Now I've already set up the instrument for the number of shocks and intensity and frequency that she needs, and we're just going to do the muscular component of it to start with. So I'll place this on here and start the treatment. So that's a sample of how the Shockwave treatment works. Now, if you have some patients that you would like to experience this procedure because they're not really candidates for surgery, but they do need something else, just take your prescription pad on there, identify the area of concern, list on their Shockwave treatment for me, and we'll set up a treatment program to give them the good results that they're looking for. And I'll communicate back with you about my findings and the progress of the patients. So thanks for joining me, and I hope you have a wonderful day.